Good afternoon, folks. This is Robert Chappell, Executive Editor of Madison 365, with your daily update for Thursday, the 3rd of December. Thank you for joining me today. It's sort of a good news, bad news day again, I guess, in terms of COVID coverage. We are reporting today 4,618 new coronavirus cases on just under 12,000 tests. So the testing, unfortunately, has not gone back up. We have seen, whereas in the past, 2 or 3 weeks, we've seen wait times at community testing sites, like the Alliant Energy Center site, of 2 to 3 hours. This week it's been like 10 minutes. So people who are not sick are just not getting tested, which we really need. To get a good sense of really what's going on, we need a lot of people to be tested, and it's not happening right now as much. I mean, to get to 12,000 tests, at one point seemed really, really high. Today, it is less so, especially since it's been in the 10,000 per day range for the past week. That's just not enough testing to get a good picture of what's going on, nor is it good enough testing to drive down our positive test rates. Because when we're testing a fewer number of people, the testing is more targeted at people who are more likely to test positive. Because you're not doing that sort of broad surveillance testing as much. You're testing people who are having symptoms or who are at risk or who have been exposed. So they're just slightly more likely to test positive. And so that's how you end up with 38.6% of today's tests being positive, which then puts our 7-day rate at 31.7% of people and 13.1% of all tests, right? So in other words, in the past 7 days, the percentage of people who have tested positive at least once is 31.7%. That kind of peaked at 36.5% a few weeks ago and has been going down ever since. And now, the past 4 days, has been on its way back up, which we don't like to see. But over the same 7-day period, 13% of the tests have come back positive, which reflects that some people are getting tested multiple times per week, right? And testing negative several times a week. I'm sorry, 13.7% of those. So it's that test rate that has forced schools to close in New York, although they're reopening now for whatever reason. But New York City closed their schools when that number got to 3. Got all the way up to 3, forced the school closures in New York City, and we're at 13.7. And we're at 31.7% of people, both of which are absurdly high numbers. And part of the reason those numbers are so high is the testing is relatively low. Because we are seeing fewer cases per day, right? Our cases per day over the past 7 days is still under 4,000. It's 3,979. But that's considerably, it was over 6,000 not too long ago. And I fear that number is kind of artificially low, whereas the positive test rates are a little bit artificially high just because our testing has been low. But also, it's true that it was a holiday last week. A lot of people got tested before the holiday to see if they could travel or not, which I don't quite understand that thinking, but okay. And now people were told, don't get tested immediately after Thanksgiving, wait a week, So we might see that testing ramp up again going forward. We are also we also know that state health departments, that state health officials are really, really concerned that there's going to be another surge coming this month. So that we might be in the midst of a surge right now. We just don't know it yet because we're not testing enough. You hear nationwide, health officials at the CDC and NIH are genuinely concerned that December, January, February are going to be very, very difficult months. So we are sort of bracing for that. Kind of, every day when I look at the numbers, I kind of look at it like this, like, oh, how's it bad it's going to be? And we haven't hit that, right. So far we haven't gotten, except for those couple of days where we were over 100 deaths being reported. There hasn't been that moment where you go like, oh, this is so terrible. It just in the past week or two, right? We've been kind of maintaining this 4,000 cases per day, going up slightly on the positive test rates. But I anticipate in the next week or two that things could get very bad. I hope they don't, but they could. We are currently at a total number of cases of 399,708, which means tomorrow we will be over 400,000 total cases. Our total death toll right now is 3,562. Which, is a lot. We were at 3,502 yesterday. We actually reported 62 new deaths today, but then there were deaths that were taken out of the data from Lafayette and Langlade counties, which means our death toll went up by 60 today. The largest number of deaths were in Milwaukee County at 11. Marathon County, Brown County each had 5. Winnebago, Waukesha, Kewaunee County each had 4. Waupaca County reported 3. A whole bunch of counties reported 2 deaths today. Wood, Washington, Walworth, Racine, Oconto, Lincoln, Bayfield, Adams all reported 2. And then Price, Portage, Polk, Ozaukee, Oneida, La Crosse, Jefferson, Dunn, Dodge, and Buffalo County each reported 1. I know Dane County also reported 1 this morning, but that did not make it into the state data. We also don't have the official count of the high school student who died of COVID over the last weekend. It does take, it takes up to 10 days to 2 weeks even to get death reported from the county level into the state data. So we're waiting for that still. So we know for sure that there are more deaths than have been reported. We know of at least 1. We know one specific person who passed away from COVID who has not been reported into the state data yet. So we know our total death count is actually much higher, or somewhat higher, I don't know, much higher than 3,562. But those are what we have officially confirmed at the state level right now. That puts our 7-day death average at 43. 46. 46 today. 14-day average is 49. Hospitalizations, this is the good news part of the day. Hospitalizations dropped again. 26 fewer than yesterday. Now at 1,754 people currently hospitalized. That's 85 fewer than a week ago. 376 of those are in ICUs. That's 21 fewer than yesterday. So the good news is the hospital population of people with coronavirus is going down. That doesn't necessarily mean that the hospital system is okay, right? It doesn't seem as if it's, the statewide system is completely overwhelmed right now. Let me check. I forgot to check on the alternative care facility. I think it went up by 1, is what I heard. So it is now at 8 patients. Yeah, it was 7 yesterday. So that's okay. That there are some hospitals that are kind of offloading patients. These are patients who are on the mend who are in recovery and just need a couple extra days of respiratory therapy and so on. So they're moving them to the alternative care facility. But it's only 8 so far. That was over 20 at one point. Okay, so that means that there are some hospitals that are actually over capacity. And we also know that beds and room availability is not the only consideration when you're looking at hospital capacity. You also have to consider equipment, PPE, and staff. And the in the media briefing today, Secretary Designee Palm of the Department of Health Services said that 34% of hospitals in the state report critical staff shortage. And another 20% report that they anticipate critical staff shortage in the near future. So you could have a bunch of empty rooms if you don't have staff to take care of people. Those rooms don't do any good. Is kind of the point. And even if the hospital facilities aren't at capacity, but the staff is, like that, that's also bad and dangerous and could lead to more death as people aren't able to be cared for. So we keep an eye on that. But again, the total number of people hospitalized is somewhat down. We're also hearing that other sort of elective procedures and hospitalizations for other causes are also way down as hospitals are consciously deciding December, January, February might be really hard, so we're gonna do like we did in March and April, and basically clear out everything that's not COVID so that we have room for COVID when it comes. Luckily, in March and April, it didn't hit Wisconsin the way it hit New York. So a lot of elective procedures were canceled, a lot of rooms were made available, and then we ended up not needing them, which is good. Now it's looking like we might actually need them. So that's what's kind of what's happening in terms of capacity. Okay. So I think that's what I have for you for COVID information. If any questions, go ahead and drop them in the comments. I will also mention a couple of other sort of news items related to COVID that the governor did announce today. Two things I'll mention about the governor's media briefing today. He announced $45 million from federal CARES funds is going to restaurants and hospitality businesses, basically, to help help them survive this, because they really should be closed, or at least doing only carry out, but not all restaurants could survive that and the loss of revenue there. So this is basically to help them through this time so that they can cut back on their service in order to keep people home while still surviving economically. That's CARES funding from the federal government, which runs out at the end of this month. The governor, in his media briefing, here's the second thing I mentioned, he said he's written to the Wisconsin's congressional delegation to urge them to pass more stimulus, more support funding to go into January and February. It's basically saying we can't wait until the inauguration or whatever. We need, and it doesn't matter anyway. The president doesn't necessarily dole out funds, right? It doesn't matter who the president is; it's Congress that has to allocate the funds. So he's asking for more funds for states. He's also urging. He also asked the federal government and the CDC to prioritize Wisconsin in vaccine distribution. You may have heard that vaccines have been approved in the United Kingdom. Vaccines are very near approval here in the United States. And there's some speculation that the first actual doses of vaccine could be deployed before Christmas. Now, I believe that the one that is closest to actually being approved is a 2-dose vaccine, which means the first dose they can give to 1 million people, and those 1 million people have to come back in 3 weeks to get the second dose. Okay, but they're prioritizing people based on age and vulnerability, and trying to get nursing homes and long-term care facilities all vaccinated first, because those are the most vulnerable people. Is where the most of the deaths are happening. But also healthcare workers, folks like that, who are just more sort of exposed. And then, other essential workers, teachers, other vulnerable populations, people with comorbidities, people with like underlying health conditions that make them more vulnerable. And then ultimately, finally, to folks like me who are just like, regular, relatively healthy white guys, right? Um, and with some saying that it could make its way all the way through that population, all the way down to regular, healthy, relatively younger folks by April or so. I tend to feel like that's a very aggressive timeline. I would guess it's more like June or July. PHMDC, the Public Health of Madison-Dane County, are saying don't expect it till September of next year. I think they're just being cautious. A couple of months here and there doesn't make that big of a difference, I guess. But but the governor's asking the federal government to, within all of those prioritizations, please prioritize Wisconsin, because Wisconsin is one of the worst, as a state, one of the worst places in the United States right now. So if we could slow it, if we could, there are other states maybe that don't need the vaccine as much because they've already got it pretty well slowed down, right? Nebraska, Kansas, California, even New York, where they're taking measures because things are getting worse, but things are much better. Even though California is like imposing new restrictions and stuff like that, overall California is in a much better condition than Wisconsin is. So he's saying vaccinate Wisconsin first, because just so we can get our numbers down to match California's and New York's and Idaho or whatever. There are a handful of other states that are as bad as we are right now. The Dakotas are as bad as we are, but not very many. So that's the ask from the governor to the federal government. Corey asks, with elective procedures being limited, do you know if hospitals are again furloughing non-COVID staff? I don't think so. I have not heard that they are. I could find out pretty easily though. I think more what they're doing. This is just anecdotal. This is like kind of secondhand sourcing, so I wouldn't put this in a news story exactly. So take it with that grain of salt. But I think what some are doing is basically saying everybody's COVID staff now, right? They're sort of redeploying people to be ready for COVID and to help with COVID. I know that some institutions are repurposing staff into like testing capacities and things like that. Like are not even healthcare institutions, but like educational institutions are redeploying some staff that have nothing to do with health services into health services for like to help with deploy tests and things like that. So I would not be surprised if healthcare institutions did the same thing. We're basically, we're not going to furlough non-COVID staff, but there's no such thing as non-COVID staff right now. Although I could make a call to the WHA and ask about that. And if anybody anybody listening right now knows anyone who works in healthcare and could answer that question, I would love to hear it. All right, if there's no other questions right now, I think that's all I have for you for today. I will remind you that we are in the midst of Newsmatch. We have met our DEI fund goal, which means DEI fund said if you raise $7,000, we will kick in another $7,000, and we did that. So thank you very much for getting us past that goal. We're just over $8,000 now for the drive, which started November 1st. We have a long way to go. We will continue to ask for donations because we are a nonprofit newsroom. We want to keep everything free. We don't want to charge money for the news. That kind of goes against our mission, right? We think everybody needs to be informed all the time. So we want to provide the news for free to Madison and Wisconsin's communities of color. So if you have the privilege of 10 extra bucks, and you can throw it at us. Knight Foundation, Democracy Fund, Miami Foundation, also other funds, Facebook Journalism Project. If you have the privilege of 10 extra dollars and you can give it to us, they will give us another 10. Every donation is doubled right now. So if you go to madison365.org/donate, you give us 10, we get 20. You give us 100, we get 200. It's really that simple. So we appreciate your support. If you have story ideas, stories you need told, shoot us an email or message us on Facebook or Twitter. News@madison365.org is the email address. We appreciate you very much, and we will see you again tomorrow.
This is 365 Media.